Imagine going to the hospital for something routine and coming out with a life-altering disaster. Today we're diving into some of the most outrageous and unforgivable medical mistakes that actually happened. We're talking about surgeons who amputated the wrong leg, doctors who left surgical tools inside people, and, believe it or not, a pediatrician who prescribed vodka to a baby. Sounds like the plot of a dark comedy, but it's all real. And the worst part, these mistakes weren't made in some back alley clinic, but by certified professionals in hospitals with diplomas proudly displayed on the wall. So before we get started, make sure to hit that like button, subscribe to the channel, and let's jump into this medical horror show. Jason Kennedy, 48, checked into a hospital in Canada for a critical operation to amputate his right leg, which had become dangerously infected. But when he woke up, he was missing his left leg, the healthy one. Jason, who belongs to an indigenous community, was crushed. This wasn't just a surgical mistake. It became a national conversation about systemic negligence, possible bias, and broken procedures. He's now learning to navigate life with a disability that shouldn't exist. While officials investigate, Jason hopes at least to receive enough compensation to live in peace and never work again. Because how do you recover from losing the wrong limb? Larissa Moraes de Carvalho was a 31-year-old med student who checked into Santa Casa Hospital in Juiz de Fora, Brazil for a simple jaw surgery. It was supposed to be low risk and straightforward, but during her transfer from the operating room to recovery, she went into cardiac arrest. Her family says she was left without proper medical attention for nearly 17 minutes, an eternity in emergency medicine. Even more alarming, the anesthesiologist had already left the room before the transfer, which is a clear violation of post-surgical protocol. She also wasn't monitored properly afterward. As a result, Larissa fell into a vegetative state. She now lives at home, unable to move or communicate. Her family is still fighting for accountability, and the case remains under investigation. A future doctor silenced by a system that was supposed to protect her. In 2013, in the city of Aracruz, Brazil, a concerned mother took her infant to a pediatrician due to respiratory problems. But instead of getting real treatment, she was handed a prescription that left her speechless. Vodka mixed with nebulizer medication to be given several times a day. If that wasn't disturbing enough, another mother revealed she received the exact same instructions from the same doctor. Pediatricians and toxicologists who later reviewed the case were horrified. This wasn't just outdated. It was dangerous and reckless. The media exploded, and the doctor's medical license was immediately revoked. Turns out he was using a long-abandoned folk remedy with no scientific backing. Just imagine trusting a doctor with your newborn, whiz, and walking out with liquor as the cure. Back in 2006 in Massachusetts, an elderly woman went into surgery expecting a routine gallbladder removal, but due to unexpected complications, the surgeon switched to open surgery, and in the chaos, removed a kidney instead. That's right, he confused her kidney with her gallbladder, not even remotely similar organs. It took 3 days for another doctor to figure out that the wrong organ had been removed, and to make it even more outrageous, she didn't even need gallbladder surgery in the first place. The surgeon's license was suspended, but later reinstated under strict conditions, requiring him to operate only under direct supervision for the next 5 years. So yeah, these screw-ups aren't exclusive to one country, they happen everywhere. In 2023, 67-year-old retiree Rita Castro de Araujo decided to treat herself to a cosmetic procedure, facial harmonization, something increasingly popular in Brazil. But instead of walking out with a refreshed face, she ended up with a medical horror story. Her dentist, Jose Augusto Patay, convinced her to use PMMA, a cheap, high-risk filler that's banned or restricted in many places. Within months, her face became swollen with over 40 lumps. The same dentist tried to fix it himself, including injecting ozone into her face, which temporarily blinded her. Even after signing a contract to pay for her corrective surgery, he bailed. And when Rita's husband tried to confront him, he allegedly got punched in the face. The case is now in court, and the dentist's defense: "It wasn't my fault." Seriously? Derry Eason, a 35-year-old woman from New York, received devastating news in 2007, breast cancer. Without hesitation, she opted for a double mastectomy to be safe, but after the surgery, a horrifying error was uncovered. Her biopsy samples had been mixed up in the lab. Derry was perfectly healthy. The mistake meant not only did she lose both her breasts unnecessarily, but the actual cancer patient didn't get the treatment they needed. And while it was a relief to know she didn't have cancer, that revelation came far too late. The emotional trauma, physical scarring, and loss were irreversible, all because someone in a lab was too careless to follow protocol. In the mid-90s, Ron Nance, a carpenter from Santa Cruz, California, was hoping to boost his confidence and love life. He'd inherited some money and, influenced by flashy TV ads, decided to invest it in a penis enlargement surgery with Dr. Melvin Rosenstein, better known by his infamous nickname, Dr. Dick. The ads promised it would be safe, simple, and life-changing. Well, it was, but for all the wrong reasons. Ron ended up with chronic pain, infections, permanent scarring, and complete impotence. His self-esteem hit rock bottom, and his physical health was wrecked. After his story came out, dozens of other victims spoke up. Dr. Rosenstein eventually faced around 30 lawsuits for medical negligence and malpractice, and only after being thoroughly investigated, he finally gave up his medical license. Talk about a dream turned full-blown nightmare. In 2013, 54-year-old Stephen Haynes from Pennsylvania sought help for chronic pain in his right testicle caused by an old injury. After several tests, his urologist scheduled a surgery to remove the damaged testicle. But guess what? The surgeon removed the left one, the healthy one. It was a simple surgical error, but with lifelong consequences. Stephen had to begin hormone therapy for the rest of his life and suffered deep emotional trauma. In 2017, a jury awarded him $870,000 in damages, which would be worth about $1 million today. A fair payout? Maybe, but there's no real price tag for losing something so personal. In 2012, a patient at the University Hospital of Londrina, Brazil, was undergoing a delicate surgery to remove an eel from his intestine. Yes, you read that right, but the actual scandal wasn't the procedure. It was the behavior of the surgical team. Instead of keeping things professional, they recorded the whole operation on their phones, laughing, cracking jokes, and treating it like some kind of spectacle. The video leaked online and caused national outrage. The hospital launched an internal investigation, and Brazil's Regional Medical Council opened disciplinary action, calling it a severe ethical violation. As a result, mobile phones were banned from operating rooms at the university. Because seriously, what kind of doctor thinks it's okay to film a patient mid-surgery for kicks? In 2016, in Salvador, Brazil, a woman named Maria Aline Duke underwent a routine C-section at the General State Hospital. After the birth, she started feeling sharp abdominal pain and had a persistent fever. Months later, after endless doctor visits, they discovered the unbelievable. A surgical gauze had been left inside her abdomen during the procedure. It caused a serious internal infection and resulted in the loss of one of her fallopian tubes, reducing her chances of getting pregnant again. The entire surgical team was suspended, and the case triggered an official investigation by the state health department. Maria had already spent over 25,000 reais on medical bills and took the case to court seeking justice and compensation. A new life had just been born, and yet the mother was left fighting for hers. In 2013, a white couple from New Jersey spent $500,000 on IVF, hoping to conceive a child that looked like them. Everything seemed fine until the baby girl grew up and they noticed she had Asian features. A DNA test revealed the truth. The husband wasn't the biological father. The fertility clinic, instead of taking responsibility, implied the wife had cheated. This worsened tensions between the couple and eventually led to a divorce. But the mother insisted it was a lab mix-up. More tests revealed that the child had a genetic trait common in Southeast Asian ancestry, proving she wasn't lying. The court forced the clinic to turn over a list of sperm donors to find the actual father. And the bigger mystery? Where did the husband's sperm end up? Probably fertilizing someone else's egg in a mix-up straight out of a soap opera. In 2012, Sandro Lima survived a brutal motorcycle crash in Brazil that severely injured his foot and both arms. After a long wait, he was finally scheduled for surgery to restore movement. One of his arms recovered relatively well, but the other? It was a total disaster. His left arm came out disfigured, with his shoulder appearing to be attached in the wrong place, like someone tried to reassemble a human body using IKEA instructions and forgot half the screws. By 2017, desperate for help, Sandro turned to a local TV station, hoping public pressure would fix the botched surgery. To this day, no one knows if the mess was ever fixed. A haunting reminder of how some patients get left behind, literally and figuratively. In 2001, 69-year-old Pat Skinner had colon surgery at St. George Hospital in Sydney, Australia. Everything seemed fine until the severe abdominal pain started and wouldn't go away. She lived like that for 18 months before a scan revealed the unimaginable. A 17-centimeter surgical scissor had been left inside her body. The hospital tried to cover it up at first, making it harder for her to report the error. Eventually, she proved it, and the surgeon even apologized. Pat took legal action and called the entire situation obscene. Just think, most people breathe a sigh of relief when they're discharged from the hospital. For Pat, that was just the start of a year-and-a-half long nightmare.